Today we are going to be talking about cholesteatomas of the middle ear. What is a cholesteatoma? Pictured on the left is a congenital cholesteatoma from a patient that they were born with. A cholesteatoma is an ear infection where the skin collects over time, and cholesteatomas can be present at birth, congenital. However, most cholesteatomas are acquired, meaning they grew throughout life, turning into a benign tumor with an onion peel-like structure. If left, it can be fatal and detrimental to the quality of life. Symptoms may vary by case and severity. What causes a cholesteatoma? Chronic ear infections and/or fluid buildup in the middle ear can be a cause. One, retraction of the eardrum creates a vacuum effect, making it easier for a cholesteatoma to appear. Imbalance of the air on the outside in the ear. Osteitis media that is left untreated and keratinized. Sweat and dead skin buildup form a cyst/polyp, and that causes eustachian tube dysfunction, which makes it easier for a cholesteatoma to grow. What can a cholesteatoma cause? Depending on the severity, cholesteatomas can cause sufficient damage. When growing, cholesteatomas break down bone and tissues in the ear, and this can cause deafness and loss of hearing. If left untreated, can lead to erosion of the skull and possible brain infections, which lead to brain cancer. Symptoms of cholesteatomas. Depending on the severity, cholesteatoma symptoms are different. Most common symptom is an unpleasant fluid smell from the ear, feelings of pressure in the ear, loss of hearing can start, constant ear infections, decreased balance, issues with standing, or fine motor skills. These are all symptoms of cholesteatomas that were significant between patients. What does a cholesteatoma look like? The mass is an onion peel-like structure, and it may or may have fluids inside of it. According to a pathology report, describes as a tan, white, and rubbery mass. In the first of two surgeries, many bone fragments were recovered as well, described as gradient pink, and that was from decomposition. Process of finding and treating a cholesteatoma. Depending on the doctor, finding a cholesteatoma can be around 6 months to 2 years. Finding cholesteatomas are not very common at all, 3 in 100,000 children and 9 in 100,000 adults. Look for other causes of hearing/balance loss first. For example, a bilateral tube insertion to help with hearing, and tonsilloidectomy and adenoidectomy to clear the airways. They will perform tests to view signs as suggestive of cholesteatoma. Real case photos. The reason why I chose this topic is because I had a cholesteatoma twice. Pictured is an MRI of my inner auditory canal, and in this photo, there's proof of eardrum retraction right here, where the air is basically being sucked out and the ear is being brought in. Those case photos continue. In this case, there is a color difference between where excess fluid or air is in the right middle ear. White color on the left photo is the presence of fluid, so this one, there's presence of fluid in the middle ear, and the white color in the right photo is the presence of air. So there is no air here in the auditory canal, but there is on the left side. Surgically removed with procedures like a tomanoplasty and a mastoidectomy. A tomanoplasty repairs and reconstructs the eardrum, perhaps with the cartilage outside of the ear, and a mastoidectomy is the removal of the mastoid bone from the inner ear and the removal of the whole cholesteatoma. Events for a tomanoplasty and mastoidectomy. Pictured is the monitor of all facial nerve movement and the timeline of events from surgery. The procedure took around 2 hours from start to finish. There were no complications, and the cholesteatoma was removed and a cartilage graft was made. The only problem that they had was a small facial spasm before the start of the surgery, and that was called a baseline facial spasm, as they were monitoring my face and they had nodes all over. They put those on when I was sleeping, and it was to make sure that they did not cut off the facial nerve, which would make facial paralysis. Healing from a cholesteatoma. The healing process from surgery is faster than other procedures. At first, there is a clear liquid diet the first day, and soft foods for about a week. And soreness does hurt, but only for about the first 3 days or so. Make sure that the site is clean without showering to prevent keloids. Most people take baths during this time because washing that too much and it can't get wet and has to stay dry in order to heal. And it also causes keloids, which are basically lumps of skin that form around it or on top of the incision site. And they harden and they get very, very lumpy. Make sure there is no heavy lifting to prevent ripping the degradable stitches that will go away on their own. In conclusion, cholesteatomas are dangerous growths with a path of obstruction. There are various symptoms of cholesteatomas, and they must be treated with surgical removal, and they are harder to diagnose than other things. Thank you to Dr. Mark Christian Thorne and his team for keeping me healthy. MRI pathology reports and timeline of facial monitoring are all courtesy of CS Mott Children's Hospital from Ann Arbor, Michigan.